This morning, the four nations of the United Kingdom issued a joint statement. It said, "We are seeing the start of a second wave." Looking at today's data, you can see why the national R number is now well above 1. And if we look at the regional numbers, we're no longer seeing growth confined to one area. This outbreak, all these are above 1. This outbreak, the government says, is now widespread. Today, we also got the Office for National Statistics survey, which is a really reliable measure of the outbreak because it tests around 10,000 households week after week. Last week, it estimated 6,000 new infections a day. This week, it's 9,600, up 2/3 in about a week. So, who's actually being hit by COVID? This chart of UK hospitalisations by age since August tells us, and it has a really interesting feature. So we know that older people, especially men, are very hard hit. But instead of looking like an upside-down pyramid, this chart now looks like a tornado because it has this bulge at the side. Young women between the ages of 25 and 29 are increasingly likely to be hospitalised with COVID. And one SAGE member told us that was probably because of the opening up of retail and hospitality. So the good news is there's not much light blue here. Very few of these young women are dying. The worry is that they might spread it to more vulnerable people, which is why self-isolation is so important. And on that topic, the news is not good. This study asked 32,000 people whether they would self-isolate if they had symptoms. This is what they said they'd do. And this is what they actually did. Less than 20% of people actually self-isolated. And the people less likely to comply were young, male, had children, and crucially, were poorer on average. So, new payments during self-isolation might change that. But with cases rising fast, the fear is that this action might be too little, too late.